We're having an exciting summit today focusing on future workforce in healthcare. The forum has been very instrumental in doing this from the beginning because we know that in order to fulfill our mission, which is to improve outcomes for Louisiana residents, we need to be looking toward the future and what changes we need to make in Louisiana in order to prepare for the future.
The trends that are going on in America today include aging complexity, the internet now ignoring geography, and consumers becoming more and more engaged and empowered. Those type of trends are all pointing toward the home. I say that because the home is the setting where most behavioral change and most good health occurs, and I define health as health being full human potential. To reach full human potential, you have to have a healthy home.
I think technology gives us an incredible opportunity to change how we provide care. It will move patients out of hospitals into nursing homes, into home care. Patients will need less admission, less hospitalization. And the second is it will empower patients to control their access to care and the kind of information they have and their outcomes.
There are a number of groups in the country that feel like that we have a shortage of physicians. In response to that, most of the leadership bodies have recommended an increase in medical school class of about 30%. And many schools are responding to that and have already increased their school size. The problem is that once you finish medical school, you have to do a residency to be able to go into practice. And Congress back in 1997 froze the number of positions in the United States. When we look at the number of students that are coming out, added to those that might come in from outside the country, we're looking at the possibility of not having enough positions for students to enter to train after medical school. Therefore, I think it is important that Congress increase the number of positions in GME, which have not been increased since 1997.
We often think about workforce or healthcare workforce as being nurses and physicians. In reality, it's a lot more than that, and we need to especially take a look at our frontline workers, those folks who aren't getting paid very much but who are absolutely essential to providing good health care.
Today we'll be talking about how physician assistants here in the state of Louisiana can bridge the gap of the lack of physicians that are going to be able to be in practice by as early as the year 2020, estimated to have about a deficiency of about 100,000 physicians nationwide between the specialties and the primary care areas. Training in the physician assistant realm covers the primary care areas as well as the specialty areas, and so we feel we're especially tailored to meet and bridge that gap of health care and the patient needs here in Louisiana to be able to provide services to those who are underserved in rural areas, as well as to assist the physicians in those areas where additional demand is in place at the present time.
It's so important in our transforming of our healthcare system with the Affordable Care Act, whether it passes or not, there's going to have to be some transformation in our healthcare system. And it's going to be so important that nurses are at the table, at the decision-making tables in terms of policy, in terms of practice, in terms of workforce education. And so with a system that does not allow that cannot be successful.
If you think of health as full human potential, almost everything that touches full human potential begins in the home setting, whether it's clean air and water, or a good educational plan for the children, or involvement of the aged and the very young in the life of the family, or safety, good nutrition. All these things begin in the home. The question is, how do you efficiently move the care toward the people? And I think the internet is very useful, and all the new health technologies are very useful because they ignore geography, and that means you can target information, data, and support and connectivity to the individuals who need it the most, and to get it to them right at the right time. Now, in the past, if someone needed help, you had to put them in the car, you have to bring them to the office. Great inconvenience for people who are managing a lot of complexity today. Remember, 50% of 60-year-olds have a parent alive today. That means that we've moved to a 4-generation American family, and by 2050, there'll be over 1 million people who are over 100. That means we're going to be 5 generations deep. So we have to figure out a way to, number 1, be in the home, and number 2, manage this 4- and 5-generation complexity in a way that is both high touch and high tech.
The example that I gave was a pilot landing a plane on an aircraft carrier. Technically very difficult, takes years of training. Today it's done by the plane landing itself using a computer. Most of us who fly commercially, when the plane lands, it's being done by a computer. Why do we need pilots even in the cockpit? So the question is, if the knowledge is out there and freely available to patients, nurse practitioners, allied healthcare professionals, what role will a physician play in terms of providing the care that's needed? So it's no longer just the need for the diagnosis. It now becomes that the physician will have to spend more time coordinating care, provide that so-called bedside manner and more human touch, and steering the patients through complicated chronic disease management.
We've looked for a long time at how to address the disparity in the rural areas, and it finally come across the idea that having a rural in, rural out model where you take students that are from rural areas with the ideas that they can go back there or be more likely to go back there, have them spend half of their medical school training in a rural area where they build a relationship with a mentor in a small clinic, contractually obligating them to practice in the state in primary care is the best solution for that. And and the tuition waivers are really what drives that, are critical to the success of that program.
I think we need to begin to educate our folks about what is really involved in the frontline work. I think we need to work with our industry to let them know the importance of it. They often just take them for granted. They need to know that there's promotion opportunities available to them if they increase their education, and they need to be given the opportunity to obtain that education.
It's not about nursing. It's about, because we are the largest component of the healthcare workforce, how can we truly contribute to change the face of our healthcare system and to improve it and to improve the healthcare outcomes of our state.
If they have any questions, we want them to go to our website, lhcqf.org.